안녕하세요. 미사 웰치과 임상철 원장입니다. 大家好，我是林상철 원장. Hello everyone. Good to see you all again. I'm Sang-Chul Lim. I welcome everyone to the Dentium Live Surgery Show. There have been many challenges this year due to global issues, but with everyone's support, we were able to successfully hold our Dentium Live Surgery Show. On behalf of the Dentium Company, I would like to appreciate everyone. Today, we are having Dr. Chung with us. This is a procedure of performing the sinus lifting with bright implant system on the both upper molar region. I expect this to be a rather interesting surgery which applies the benefits of the bright implant system and the Dentium DASK Simple kit. Okay, let's take a look at today's case. Today's case, as I mentioned before, bilateral sinus approach with DASK Simple. About the patient information. Patient is a 43 years old male patient. She wants to have a fixed prosthesis. He got the past dental history, extraction of a remnant of the root rest and the periodontally compromised teeth. And about the medical past history is DM, diabetes mellitus. This one is actually first visit view of dental clinic. As you can see, the poorly, the periodontally involved, compromised teeth are seen, and also the remnant of the root rest on the both maxillary molar area. And lower jaw also very similar situation. The percussion involvement and the periodontal layer faction, all the bones already destructions until the apex portion of the root of the teeth. So this kind of situation need more strategic approaches. So after extraction, all the hopeless teeth was gone by extraction. After 5 years, as you can see, both posterior maxillary area ready to get sinus elevation with the implantation, as you can see. So the CT CT view is as follow. Number 17 area, very actually the remnant of the bone volume is not enough. So sinus elevation is necessary procedure. 15, number 14 is also we can do the simultaneous approach with implantation. What about the number 24 area? Number 24 also not enough, but we can do something more with the GBR procedure. And 25, 26 areas, lackness of remnant of the bone, so we need GBR procedure and sinus elevation also. This one is intraoral view of the patient. The vertical stop and occlusion still survive, as you know. So we have to do both maxillary sinus elevation and implantation simultaneously. And as soon as possible, as soon as possible, we can make new teeth implant supported fixed prosthesis for our patient. At this time point, Dr. Chung is going to use DASK Simple kit. This one is actually compact version of the original DASK kit. This one is upper right area and upper left area. The soft tissues already healed site. The surgery plan is here. Number 14, 15, 16, 17, 24, 25, 26. All the 6 implants will be installed, both sinus elevation and the posterior maxillary area. At this time point, Dr. Chung is going to use a bright implant system, tissue level and bone level. And also, DASK Simple kit is shown you for sinus lifting. And about bone grafting material, we can see the osteon 3 collagen grafting material. Just a brief introduction of sinus kit. This one is DASK Simple. DASK Simple, as I mentioned before, the compact version of DASK Original. So what's new? Actually, the sinus curette is a smaller size than the original version, and the crestal drills are skipped, and the drills actually like the reamer style, and the graft spreader is added to this kit. So this one is the grafting situation using the graft spreader. Actually, this one is optional, not mandatory, the instrument. Okay, this one is the graft spreader, and the left one is crestal drill. This crestal drill have a stopper, the built-in stopper type, a drill. So we can make this drill, we can use this drill with a stopper for the proper length. This one is, these 2 drills are unique of the DASK Simple kit. Okay, about the bright tissue level, as I mentioned before, actually many times I introduce about this tissue level and the bone level implant of bright system. So this tissue level is the spreading very fast and well now. So these tissue level implant fixtures for simplified surgical procedure and the minimalism concept, the combined minimalism concept and the elder person all together, combined all together make a better result, right? Bright tissue level and the minimalism concept for elder person is the optimal treatment protocol as I think about the elder person. Okay, the bone level, the unique type, 10-degree internal connection, 3.7 deep connection type. It means excellent joint stability. Internal hex is 2.1 millimeter. Got a long triple cutting edge and aggressive thread design and double thread. All of these designs make easier and make better to get the initial stability when we have a softer bone or the poor the installation condition. Osteon 3 collagen, very well known, the graft materials, the hybrid type, the collagen material. Actually, this one is graft materials used in sinus cavities and GBR procedures and very versatile on many other defect situations. Collagen graft 2 is brand new. Actually, this one is the the faster soft tissue healing by arterialization. This one is our first purpose to use this collagen graft 2 instead of collagen membrane. So when you have a collagen graft 2 instead of collagen membrane, you need a little bit different the approaching procedure for a defect like a GBR procedure. Okay, this one is a similar case. For comprehensive understanding to you, actually just a brief introduction about the similar case compared to today's. The overcoming sinus perforation, it means at the first time when we have a crestal approach first, unfortunately, the sinus membrane can be teared during instrumentation, the sinus lifting procedure. At this time, actually at that kind of situation, we can do the lateral approach for overcoming this sinus perforation. The small semilunar incision with the surgical stent, so minimize incision and drill and the implantation. That was target and priorities for this surgery. And however, using this the DASK crestal drill, unfortunately, sinus membranes can be torn. Even though the sinus membrane tearing, we can do the lateral approach instead of crestal, right? So prep reflection more. At this time, we add a vertical incision for prep reflection, and using this DASK drill, the big round bar, diamond bar, and removing the lateral wall, as you know. So using many different types of sinus curettes are available, to detaching the sinus membrane from the sinus floor and lateral wall, and then we can do osteontry collagen applied. Skip the collagen membrane, just to put the osteontry collagen graft materials, overcoming the sinus membrane perforation. So that is another one option to overcoming the membrane tearing. And the implantation, suture, and the waiting for healing. And well, very nice healing situation looks like here. 1 month, 3 weeks. It means almost 2 months after 8 weeks. Okay, so second stage surgery. This second stage surgery, depending on insertion torque, initial stability, and remnant of bone. And there are many factors, considering factor to have a second stage surgery when you have the early, the exposing, and the loading, right? So 2 months is not enough time, the ordinary sinus elevation, the procedure, no, right? So the 2 months is early expose and the loading time point. But anyway, Dr. Chung is trying to this PMMA and temporization and the progressive loading procedure until the final lastration, and the 2 or 3 months later, the final zirconia customized abutment, final lastrations delivered to patient's mouth. Okay, like this one. Okay, sinus lifting use DASK, also the similar situation, the previous one. At this case, showing us about the osteontry collagen, how can I use this osteontry collagen and the crystal drill and combined with the bright implant picture and covered by this collagen graft instead of collagen membrane. What is the advantages using when we use collagen graft instead of collagen membranes? Okay, so I will explain later. Okay, so we can see clear the grafting materials in the sinus cavities with the bright implant system, bright implant the bone level. And this one is temporization. And the final lastration is zirconia with a customized abutment. Okay, final restoration panoramic view. Okay, let's move to the surgery room. Dr. Chung is prepared the left, upper left, the molar area first. Okay, he is going to have a crystal incision. And the clavicular incision here. About the crystal incision, as you know, from the mid-crestal portion, actually 2 millimeter, the parallel, the moving to the parallel side is better to flap management and the surgery, the field, and the implant real sequence. Better surgical field, better the achieving the surgical field when you have 2 millimeter, the parallel, the inclined from the mid-crestal incision. Okay, the flap reflection procedures are now using the back action chisel. There are many useful instruments when we have flap reflection. The small round curette, the also available, and the ocean bind chisel like this, the back action chisel, and the small round, the peristal curettes applied for a full thickness flap reflection. As I mentioned before, number 24 areas get the exposed the bone defect. I think almost 2 to 3 were style, so very thin the alveolar ridge. So how can I approach this sort of situation? Very thin ridge and the 2-well defect. So how can I deal with this kind of situation? The GBR and block bone graft and sticky bone. There are many different ways. However, today Dr. Chung is showing us about the minimized and simplified, easy approaching to like this narrowed ridge. How? Using the bright tissue level implant fixture and the GBR procedure, a simplified GBR procedure. Yeah, the Lindemann drill first with the blue color, the lower space, the connected to Lindemann drill. This spacer is very useful and mandatory. The devices when you have a freehand type surgery to get the proper insertion position, the initiation. Okay, Lindemann drill first here, and put the paralleling pin here. Yeah, Dr. Chung is going to have a minimized GBR procedure. So for achieving this, the purpose, he will use narrow diameter tissue level bright implant system, and the osteon 3 collagen, the collagenized bone. Okay, another one. Can you see the 7 millimeter marking? The 7 millimeter, 7 means diameter, the 7, right? So this 7 is mesiodistal width, very similar to the natural, the free molars, mesiodistal the width, right? So 7 millimeter, the indication pin means 2 premolars, the proper positions to achieved. We can, we can get the proper position, even though the freehand style surgery without the digital guide, without the guide. However, the proper positioning with the accurate position when you use this the blue color, the spacer. At the first, like this one. This one is marking 9 millimeter. Can you see the 9? 9 means 9 diameter, 9 millimeter. The diameter is 9, the bigger diameter than the previous one. Previous one is 7, this one is 9. 9 means first molar from the mesial to distal, mesiodistal, the width. So now he is using the crystal drill. At this time, Dr. Chung is remove the stopper, just a stopper-free drilling with a crystal drill. This crystal drills, the top portion, the actually end portion of the crystal drill looks like a reamer. So even though the touch the sinus membrane directly with a lower RPM, lower speed, so just a touch, but the preventing the membrane tearing because of this design of the drill, the safety design, right? This unique style, the crystal drill, is another one big different thing to the original DASK kit. The original DASK kit doesn't have any this, the crystal drill, just the round, the small, the round, the pointed, diamond pointed drills, the equipped in the kit for the crystal approach. However, this DASK Simple, the contained this the unique, the designed drill for to accommodate this crystal approach. And the separation, this one is actually separation procedure. Until the flower of the sinus, using this crystal drill, we can feel the touch, feeling touch, and stop the drilling, and then we can use this the small round curette, the separating sinus membrane from the sinus floor. And after that, there are many different sinus curette also applied for more to separate the sinus membrane from the sinus floor. When we have sinus membrane, the separation, we can do the bone grafting procedure next. When we have a bone grafting procedure, as you can see, this kind of osteon 3 collagen is one of best option, right? Okay, and pushing these graft materials in there, in the sinus cavities using the crystal drill. These grafting materials automatically put it in to the sinus cavities. if we use these ostentatory collagen graft materials instead of particulated bone, the time saving to bone grafting into the sinus cavities and the simple, and the preventing the grafting materials scattering. Okay. You have to keep in mind about the bone grafting volume. Normally, the remnant of the bone about 3 millimeter. For one implantation with a sinus crystal approach, how much bone graft materials are needed? Actually, the normal level 0.25 cc, right? 0.25 cc for single implantation when you have a 3 millimeter remnant of sinus, remnant of the bone. So we have to prepare bone graft materials, the minimum 0.25 cc, right? If you have a 2 implant installation with the crystal approach, you may need 0.5 cc, the minimum, right? Okay. So we can counter the bone volumes and I think at this time point, sinus membranes as small perforations that will maybe happen, cause of erupted the drills inside into the sinus cavities is not good sign, right? Okay. This one is graft spreader. This one is the optional. Actually, it is not mandatory procedure step. Spread the drill. You can use a spread the drill or a DASK gaze, the small round pipette, and the flute style, the devices, and many different types of devices is to putting the graft materials into the sinus cavity, as you know. So depend on your style, you can choose the proper devices for the convenient. Okay, I think, yeah. I doubt sinus membrane perforation. However, Bersama is okay. Even though the small sinus membrane perforation, wide the detachment, when the sinus membrane wide detach it, the Bersama, we can see the Bersama, the small perforations, even though the small perforation. Okay, after the sinus crystal approach and the final drilling here, yeah, the almost 9 millimeter. He got the 9 millimeter. He is preparing the 9 millimeter length of TL, the bright implant. Okay. As you know, the tissue level of bright implant, the top portion and platform is single the platform, 3.8. Right? Even though the smaller diameter until the wide diameter, the top portion of the platform of the top portion is same, 3.8 millimeter. And the gingival height, 1.5, the single platform, a single gingival height. Yeah, he is planning for 3.5 diameter, 9 millimeter tissue level. Now he is doing the installation. These tissue level, the apex of fixtures, the sharply taper, so easy to sitting. However, during the condensation of the bone, actually we can get this implant fixture is going more and more the stability, the getting more and more, getting better, and the good stability. And also the top portion of this S curve of the fixture, the auto stop function, they gave us auto stop function. So don't worry of this. Actually, you don't worried about the too much deeper insertion when we have especially the tight the situation, the lower mandibular area, actually nerve or some sinus areas, and there are many the nervous areas, nervous regions around here. When you use this tissue level implant fixture, you don't have any fear cause of a top portion of S curve, top portion of tissue level is auto stop function, gave us auto stop function. Doesn't make any deeper insertion like bone level. Okay, so she is making the lateral window. Why? Cause of the sinus perforation. When he have the crestal approach, maybe small the sinus membrane perforations was happened. Now, using this black diamond bar, this one is the faster and stronger, removing the lateral wall. And after that, they're using this the sinus curette. First, as you know, the elephant foot is first, elephant foot first, and next, the different angled sinus curette will be applied, and finally, long ball instrument should be applied to separate until the medial wall of the sinus, right? The full detachment of the sinus membrane until the medial wall, you have to use like this long ball instrument here. So, yeah. So everybody make sinus membrane perforation during sinus lifting. The especially crestal approach is more frequently happen. So when we have a sinus perforation with the crestal approach, don't be scared. Actually, make a vertical incision, wide reflection, and using the DASK drill, make a lateral window and the elephant foot to the detachment of sinus membrane, and the different angle the sinus curette will be applied for sinus membrane detachment from the lateral wall and the sinus floor. And now the bone grafting, the osteon 3 collagen inserted. Yeah. They basically depend on the sinus cavity. The bone graft material's volume is so different. However, the standard bone graft material's volume for two implantation with the lateral approach, about 3 millimeter of remnant of bone, the minimum 2.0 cc of the bone graft materials should be prepared. Okay. Okay, actually after bone grafting, to try fixture installation. This one is a bone level, a bright implant. Yeah, 10 degree, 3.7 millimeter deep connection. Okay. Okay, good. Yeah. Dr. Chung is going to use 7 millimeter length, 4.5 diameter fixture and connect with the cover screw for submerging, and he is using the ocean vine chisel to harvest autogenous bone, the maxillary tuberosity area. This, I think he is going to have a sandwich technique, layer technique for number 24 areas GBR procedure. Okay, take it off from the maxillary tuberosity area. This bone chip put on the labial side of number 24 implant fixture, and yeah, tool defect around there, and the squeezing with the ocean vine chisel. The squeeze to surface of implant. Actually, as you know, the exposed implant surface, which kind of graft materials are best choice, right? Autogenous bone. So Dr. Chung is harvesting the autogenous bone first, and the next, ostentary collagen. This one is actually alloplastic graft materials. The autogenous and alloplastic combination is getting better, the outcome. The inside of autogenous, getting a higher properties, high potential to make a new bone formation. Out layers of ostentary collagen, alloplastic bone, that gave us the performance of the volume maintenance, right? And after that, the collagen graft applied here instead of collagen membrane. Yeah, these are the collagen graft materials, the porcine origin, the layered porcine origin. This one is actually the activated, the promoting the soft tissue healing when you have the mucogingival surgery. So sometimes we can use like this GBR site. Yeah, here is a suturing now. Actually, I want to say a little bit more adding this procedure. For me, actually, if possible, the connective tissue grafting on the labial site of number 24, 25 area is better because of, as you know, the collagen graft is not enough the barrier function, the ordinary. So at this time, if we can harvest the connective tissue from the palate or some these the maxillary tuberosity area, I think the healing potential make it higher, and the protection, the abilities make it higher, right? So, you know, we can try. You can try harvesting the connective tissue and then put the graft materials on the labial site of the number 24, 25 area. Okay, collagen bone fill. Okay, thank you for the good question from China. The question is how to judge whether the collagen bone filling in place. Actually, basically, the bone fill and new bone fill should be judged by the histologic test. Taking the histologic specimen and make a specimen and see the osteoblast and osteocyte, and all the specimens they analyzed by like this histological procedure. However, in clinically actually, we can see when we have a second stage surgery, we can put the G explorer and some other instrumentations, this bone transforming to new bone or not, right? So this one is clinical, the approaching the method. This osteogen 3 collagen is prevailed now, as you know. Yeah. This the graft material is very favorable in China, especially the Osansi. The source is alloplastic. The osteon 3 is alloplastic graft materials. There are many collagenized bone now in the market, the bovine origin, porcine origin, right? So the collagenized bone is prevailed now. So we can choose, depend on the style and depend on the defect, depend on the purpose, the alloplastic collagen, the bovine collagen, the porcine collagen, it doesn't matter. The Dentium companies are launching to the bovine source graft materials, the osteogeno, right? Now we are available to use this osteogeno in Korea. I'm not sure in another country, maybe during the qualifying procedure, CE and the FDA and CFDA, yeah? And in the later, we can see we can use this osteogeno, the grafting materials. It depends on the situation, depend on the purpose, depend on the defect. So we can choose a different kind of the graft materials, right? The osteogeno collagen, the osteon 3 collagen. Now in this case, actually inside of the defect site, they're already done with the autogenous bone graft, and the outer surface, Dr. Chung is want to make the performance of volume maintenance. So Dr. Chung chose the osteon 3 collagen graft materials, alloplastic. Okay, the upper left areas was done. Now he is moving to right upper right area. So can you see the crestal incision? As I mentioned before, from the mid crestal 2 millimeter to the palatal is better to manage the flap and better to the surgery field, capturing the surgery field. Okay, the posterior portion, Dr. Chung is prepared to make a semi-Luna style. Okay, the cross-checking, the make assurance, the crestal incision, and now the flap reflection procedures started. Now he is using the back action chisel. Seems like wider, the ridge width is wider than the opposite side. I think number 14 area is better, much better than number 24 side. So I think a little bit wider diameter and longer and without the GBR procedure. Make it easy and make it better due to the ridge, the remnant of the ridge. Okay. Depression, the distal part of canine got the depression, like here. So, yeah, but I think not serious not a serious situation. So I think Dr. Chung is simply and easily applied to these two both area, number 14 and 15, with a bright tissue level implant fixture. Okay, so Lindemann first here. Yeah, he is considering of the canine, the root of the canine axis. Okay, according to this axis of canine, he is considering the path of number 14 implant fixture, drilling. Very important factor when you have a number 14 and 24, the first premolar insertion, cause of the canine, the ordinary little bit distally curvature, right? So we have to consider distal curvature of the root of canine. The following this curvature, the number 14 or number 24, little bit inclined. The osteotomy is a necessary part. Okay, this diameter 6 millimeter. Can you see the 6? Number 6. It means the diameter of guiding pin. The estimate the diameter, the final lastration's diameter, we can estimate. Okay, I think a 4.0 diameter, 9 millimeter implant will be inserted around this area, and checking the sinus prober. Yeah, we have decided 9 millimeter. 4.0. What do you think about the same diameter, 4.0, tissue level of bright and the bone level? Which one is stronger? Yeah, in the factor of connection, in the factor of mechanics, the tissue level of 4.0 is stronger than the bone level. As you know, the bone level is internal connection. The word sometimes is a weakness and weak point. The point of connection. However, this built-in type screw abutment style, the unique design, the bright, the tissue level implant fixtures gave us so much, the much better, the stronger situation, right? Basically, external connection type. This one is external connection. The brand of tissue level, like a Straumann and any other, the company is actually internal connection, even though the tissue level. However, this bright, the external connection type. So it is a big different thing. This unique design makes us much more do the final prosthesis. Okay. Oh yeah, too strong at tugging into the bone. So Dr. Chung is the reverse screwing. Yeah. The very high insertion torque is achieved. Yeah, that he is doing the crystal drill in DASK Simple kit. The top portion of the end portion of drill, like a dome shape, and the reamer style, not cutting edge actually. No cutting edge, just the reamer style drill. So when the drill touch the sinus membrane directly, the sinus membrane is protect from the tearing. Okay. Okay, this area is remnant of bone, a small bone volume, about the 3 millimeter. Actually, under the 3 millimeter, around the 3 millimeter, is best indication for lateral approach. However, Dr. Chung is going to try the crystal approach instead of lateral approach. So let's see. Let me see. Okay, they're using the crystal drill, and Dr. Chung is trying to crystal approach. However, the portion, the site is number 17, not 16, 17 areas. Cause of number 17 is a better place for crystal approach. And also, in the mechanics, as you know, number 14, 15, 17, so combine each other, make a 4-unit bridge is better. number 14, 15, 16, and cantilever, right? So which one is better? You know, 14, 15, and 17, 4-unit bridge is better than 14, 15, 16 cantilever, right? So Dr. Chung is trying to install the implant fixture on number 17 site, the crystal approach. And after using the crystal drill, now this elephant foot drill, elephant foot instrument is very efficient and most important instrument when you have sinus elevation. Number one preferable instrument in the DASK kit. After using this, the elephant foot and the different angled, the sinus curette applied. Why? The reason is the separation of the sinus membrane from the floor, right? It's very important. The wide detachment of the sinus membrane, it means make higher the bone grafting and the sinus elevation, even though the crystal approach, right? If you want to have a higher sinus membrane elevation using the crystal approach procedure, before then you have to separate the sinus membrane, the wider, right? Is the key into the room, the success of the crystal approach, even though the smaller bone volume. In this case, actually around 3 millimeter, very small bone volumes remnant. So as I mentioned before, this one is actually the lateral approach indication, good indication. However, Dr. Chung is trying to crystal approach using the DASK Simple kit, using crystal drill and another instruments applied, so successfully elevated. Yeah. The key is the separation of the sinus membrane from the floor. Okay, and after that, the grafting. The bone grafting is ostentary collagen, the same as before. Okay. Yeah, good. That's so far so good. As far as I know, there are many big names on the sinus elevation, like Dr. Chung. They are the preferred to the crystal approach than the latter now. Why? The clever, the development of the devices like a DASK kit and the hydraulic power, and there are many devices developed for the crystal approach. So very famous, big named dentist is going to have a crystal approach now. The very simple and the faster. Even though 2 millimeter, 3 millimeter is not contraindication of crystal approach now. Okay, they're pushing the graft materials in the sinus cavity. All the graft materials in there, and with the crystal drill, and put the fixture, and that's it. This one is a graft spreader. It is the one of the option. The spreading, the purpose of using this the graft spreader, actually the spread the graft materials into the sinus cavities, the different way, different direction. However, for me, I prefer to use the depth gauge and the small, the round shape, accurate. Okay, the diameter, 4.5 diameter and 7 millimeter. The bone level implant inserted with the cover screw. And any other, he didn't any other bone grafting procedure on the labial portion. He want to connect scanning jig, scanning cap, the actually comfort cap, the official name comfort cap, the dual function, the scanning jig and healing. The cause of higher insertion torque. Okay, to a tissue level, connected with the comfort cap, a scan comfort cap for intraoral scanning actually. And instead of a flap suturing, he is going to use a pin, the fixation of the flap. Yeah. Okay, so this the pin have a notch to easy engage to the bone, and yeah. Dr. Chung is prepared to use this pin instead of suturing. Okay, sometimes this pin is time consuming. So the suture is basic, the basic procedure is a suture. So okay. For zero suture, for interrupted suture, interrupted suturing first here, and additional suture for flap closing. Additional suture is necessary part. I think 2 or 3 stitches more, need more. Okay. Yeah. The tool is at the bright tissue level and the ostentary collagen and the DASK Simple kit for performing the sinus lifting with implantation simultaneously, both of maxillary area. 6 implants already done with the GBR procedure, simplified, and sinus elevation, the crestal approach and lateral approach with the DASK Simple kit. And all the procedures looks like simple, even though the remnant of the bone of maxillary posterior areas, just a smaller bone volume about under the 3 millimeter. However, Dr. Chung has done looks like a simple procedure. So how can he achieve this kind of procedure like a simple? First, experience. Second, skill. Third, maybe the kit and the good implant system. Okay, this suture will be a final. Yeah. He will get the finishing line of today's surgery. Oh, yeah. 1 stitch more. Okay. So, yeah, the surgery was done. And thank you for watching today's surgery. We will have a 10 minutes break time, and I will back again, and we will get the Q&A session with post-op panoramic view and CT. Thank you. Welcome back. Let's see the post-op panoramic view. As you can see, number 14 and 15, the proper and the accurate, the precise, well-done position installed with a scan jig, the compact cap, as I mentioned before, and also number 17 area, 17 fixtures, also good situation with the crystal approach. We can see the concentrated, the bone graft materials inside the sinus cavity. And what about number 24, 25, 26? Also, the well installed, especially number 26 area, these bone grafting materials, the tomb-like style, the sinus elevation and bone grafting situation. This tomb-like sinus elevation and bone grafting situation is the traditional sinus lateral approach after view. Okay, what about the cone beam CT? As you can see, the cone beam CT is very nice, good result shown us. Number 14, 15, all the implant surface fixtures installed host bone very strongly with, so that is why to connect with the compact cap. And number 24, 25 also good installed with the host bone. However, this one is not enough stronger than the number 14 and number 15. So this one is just stayed in there. And number 26 area, even though the sinus membrane perforation during the crystal approach, the very well overcome by lateral approach with the bone grafting materials. Okay, actually, today's surgery was done 1 week before. So today's title was Surgery and Follow-up. So about the follow-up data, follow-up photo, after 1 week later, the surgery, the 1 week healing situation, intraoral view. 1 week is not enough for the soft tissue healing, right? So however, this number 14 and 15 is still during the soft tissue healing situation. And number 24 and 25, we can see the small particle of osteontry graft materials, osteontry collagen graft materials. So these areas was done by GBR procedure. So need more time for another procedure. Okay, so the Dr. Chung have decided about this number 14 and 15 is going to have provisional restoration, custom with the PMMA intraoral scanning. CAD restoration, the CAD design for provisional restoration, and we will deliver this custom with the PMMA temporarization, temporary crown to our patient for the provisional restoration, and actually until the final restoration, the transitional occlusal loading is necessary part. Okay, so we will have let's see the question from the China, maybe. Number 1 question, what should I do if maxillary sinus is torn? Depend on the membrane, the tearing size, actually, and depend on the procedure. When you have a crystal approach during the sinus membrane tearing case, actually we can overcome the lateral approach, done by lateral approach, as you can see. In the surgery video, can you remember number 26 area? The first, Dr. Chung is trying to have a crystal approach with the crystal kit from the DASK Simple. However, he feel a little bit small tearing of the sinus membrane. Immediately, he want to move lateral approach, flap refraction widely, and make a lateral window with the DASK drill, and make a lateral window and separate the sinus membrane. All the procedures, the step-by-step, the overcoming sinus membrane tearing case, right? First, when you have a sinus membrane tearing, during the crystal approach, stop the crystal approach procedure and make a flap wider and flap refraction, and the move to lateral approach with make a lateral window. All the procedures are same of the lateral approach. Okay, so during the approach, sinus membrane, we can see the tearing part, even if the smaller portion flip each other. Cause of a sinus membrane have flexibilities. We can see anymore the perforation area after sinus membrane elevation, right? However, when you have a lateral approach, we can make also the sinus membrane tearing. Depend on the size, maybe defects, the tearing portion is big, and it is very difficult to get the overcoming procedure. Just stay there and the flap cover and the suture and waiting 4 months. And after that, trying again to make a lateral window with according to the lateral window procedure, right? However, a small perforation, actually small means 2 millimeter, about the 2 millimeter, sometimes 3 millimeter, small perforation. When we have a lateral approach, stop the sinus membrane detaching procedure. Stop and make a wider lateral window. How? Actually, the tearing point is here, and stop touching anymore about this area. Far from this tearing area, we make a little bit more, another window, right? And then the detached procedures are restarting with the fresh sinus membrane, and the little bit more and more, and all the sinus membranes detached from the sinus floor and lateral were maybe these perforated areas automatically overlapping cause of sinus membrane flexibility, right? So after that, if we can see the perforation area still there, the membrane covered it, or we cannot see anymore the perforation area, just to put the sinus graft materials like osteontry collagen. Collagenized bone is better without collagen membrane, the barrier membrane, right? See the membrane perforation area still there, and cover the sinus membrane, right? And we cannot see anymore cause of a smaller, flip each other, folding each other, and just the collagenized bone in it. Put in it. That's it. Okay. And number 2, what is the function of crystal drill? The crystal drill is brand new item of DASK Simple kit. So the previous version, the original DASK kit, doesn't have any this kind of instrument, right? Crystal drill and the graft spreader. And this DASK Simple brand new kit have this crystal drill. The crystal drill shape, the top portion of drill like a lemur, doesn't have any cutting edge. It means directly contact the sinus membrane, breaking the sinus floor, the membrane doesn't hurt, so just still intact remained. And this drill make a bone chip, the top portion of drill to make a bone chip inside the sinus cavity. So automatically bone chips condensed in the sinus floor. So it is another the benefit when you use this crystal drill, right? And the squeezing and the compact and making a bone chip into the sinus floor. And all these procedures are automatically just using the crystal drill, the 50 RPM, like a lower speed, right? And okay, all the questions. Thank you for this question, especially the China. 谢谢大家. And the next live surgery will be held December 16th, 7 o'clock in Korea time. Thank you for watching. Thank you for having me. 谢谢大家. See you next time. Bye.